Well, good morning, everyone, to our inaugural call with Dr. Ash. And I just want to mention, Dr. Ash, you have an anniversary. Was it yesterday that you're...
It was yesterday, my 15th year with Nikken. Best day of my life was May 7th, 2001, when I was introduced by Herb Rapp to this amazing company. And my vision in life was to help people have a quality life. And here I found a company that had a bigger vision than me. It was like I looked at my life and I looked at the 5 pillars and I said, I want that for my patients. I work really hard for that. And then I went, wow, I don't have hardly any of that. So it was a real big picture, Dave. It was great. So it's been a great ride so far.
Oh, that's awesome. I'm just kind of thinking about the idea. So many people become a doctor because of something that happened maybe earlier in their life, and they just saw this as a sense of mission to help people. And yet, with that marvelous ability of being a doctor with knowledge and tools and everything, basically you have to physically interact with them typically to help them. And adding Nikken to this and becoming another aspect of being a doctor, which is a teacher, teaching people how to teach other people some powerful, simple ideas. You can really make a difference in the world rather than just somebody that's on your own porch helping them personally. You can really cut a wider impact, a bigger net to catch more people into this wonderful revolution that we're beginning. So anyway, hey, tell us a little bit about your journey. You're a doctor of osteopath.
Yeah. I'm an osteopathic physician, osteopathic family physician. And basically the interesting thing about that is that the philosophy of osteopathic medicine, different than allopathic medicine, is that we look at the whole person and we believe that if you give the body what it needs, it heals itself. So Nikken is a perfect arena to work into what I do in Western medicine. And you know, when I first started, I realized that I couldn't go home with every one of my patients, and I was an RN before I was a physician, so I love to teach. And then what I really said to them, look, I'm really your coach, and what I want to do is to teach you what you need to know, and I want you to know everything that I know about your health, and then I want you to know more than that. And then around that time, you know, we started to get the internet, and people started to give themselves permission to question doctors and to go out and do some research and to get second and third opinions, which before that, it was, well, the doctor said, and so that's what I'm going to do. And you'll still find that in some of the more elderly population where they were trained that if the doctor says this, you do this. And so sometimes we as wellness consultants come up against people who won't try something alternative unless their doctor approves it. And one of the challenges with Western medicine is that everybody's taught to practice evidence-based medicine. And so then they'll always ask for the studies. But you know, we do a lot of things that are basically off-label. There's a lot of things that they haven't done studies for that we know work, and when we're prescribing different types of medications, et cetera. So it's really not so far-fetched, but I would just suggest to those listening that when you find a physician who wants to see the evidence-based study, hand them a few and walk on and go talk to 5 more people, because you make more difference.
Oh, that's a good point. I've always kind of thought of the idea that a regular person, not being a doctor, you don't want to get in trouble. And if you meet somebody and you're visiting with them and you say, well, you know, I think you're constipated. Well, you're making a diagnosis. And if you say, you need to eat some prunes, that becomes a drug. Yeah. But if you can say, it seems what's going on, it seems like maybe you're constipated, and you know, whenever I eat prunes, that seems to help, and then it works a lot better.
Yeah. So let me talk a little bit about, I can't remember even when this first started, and the title I gave it called Stump the Doc, Dave, but I think it was a number of years ago where people had questions about which Nikken technologies they should start with first, you know, and at one point in time we had something like 138 different products, and it was really pretty overwhelming. I remember when I first started, there were several categories, but we didn't have water and we didn't have air, and we really didn't have very much in the way of nutrition. But it still took me about 5 months to kind of listen to and it was VHS tapes and it was cassette tapes, and to listen to all those and learn about them and go to the different conferences and start to learn about the products. And it was important to me that I knew, just the way I knew pharmaceuticals, that I knew about these products and how they worked and about them. And so I started to become the person that people would ask about, well, what product would you use for such and such and so and so. And then once you get into the company and to the business, more things are released and you learn about them one at a time. It's a lot easier than when you come in and have to kind of get your arms around all the things that we have. And thus we went to the term wellness home, which I think is fabulous. And and now we've kind of transitioned to using the word self-care, and that's just key. It's absolutely key that people take responsibility for their own health and for the choices they make, and they become educated. And my definition of what I do is that I'm a coach, and I've been doing that for over 30 years. That's how I describe myself originally. And people would come in and they would ask me questions because they had done research, and I would say, oh, I'm not sure about that. Let me check it out. Let me look it up. And the good news and the bad news about the internet is there's a lot of good information. There's a lot of bad information. And just because it comes from the internet doesn't mean that it's good information. And so we need to know that. So it's a lot of times really important to talk to your healthcare professionals and get that squared away. But anyway, we started to have a call, and some of the wellness consultants would bring in customers or people who were looking at our wellness technology, and they would say, this person has Tsutsugamushi fever. And if you went to the medical literature, there was a paragraph about this big about Tsutsugamushi fever. And so I'd have to say, whoa, let's see, I don't even know that I know what that is. Tell me a little bit more. Or they'll come in with acronyms, because everything in medicine is an acronym. And so that's how we started. And so I started to make a joke about it, that if I could get through a 20-minute call and not have somebody ask me about a disease that I had never heard of, because it was super, super rare, that I made it through the Stump the Doc call. So that's how the origin of this went. And, before we get started and have people be able to ask me questions, a couple things. The first one is that, if you give the body what it needs, it heals itself, which, as I said, is the philosophy of osteopathic medicine. And we don't make any medical claims in Nikken. So as I start to talk about different products, it's really about what might be helpful to the body to get it back in balance so that it really can heal itself. And something that's different in Western medicine versus working with wellness homes and self-care products is that in Western medicine, we try to just give one new pharmaceutical or one change to see what happens with the body, because if we give 2 or 3, we don't know which one's having a good effect, or more important, which one's having a bad effect. And it doesn't take watching too many commercials on television about the side effects of the drugs to see how significant that is, right? And I always laugh and say to people, if you ever read about aspirin, the side effects of aspirin is 2.5 pages long in the physician's desk reference, you'd never take an aspirin because you'd just be terrified of it. But we don't think anything about aspirin, and people take it all the time because it's over the counter, et cetera, et cetera. So a lot of the over the counters we actually get into trouble with because they aren't prescription and they aren't given by physicians. But basically, you'll hear me say over and over and over again, eventually you want people to get to the wellness home, because what we find is that 1 + 1 = 100. If you give the body what it needs and you give it all of the things that it needs, it really thrives. It really thrives rather than just surviving. And so I will always say, because we're 70% water, I will always say to start with the water. I have to tell you a quick story. I had a young man come in, 16-year-old, with his mother and his sister, and he was drinking a Pepsi. And she said, he's had a lot of weight gain recently. I said, really? I said, how many of those do you drink a day? And he said, 8 to 10. And I said to him, just turn that bottle over and tell me how many calories are in that. And he said 260. I said, well, before you get done with your day just drinking cola or Pepsi, you're getting 2,260 calories a day. Your base intake probably is about 2,000 calories because you're sedentary to just stay where you're at. So you're already over it. And if it's 3,600 calories equal 1 pound, you're gaining 3/4 of a pound every day just from drinking 10 bottles of Pepsi. And so then his sister says, well, but I'm drinking this healthy stuff. And she was drinking the vitamin water. I said, yeah, give me the bottle. And so I looked at the bottle, and the first ingredient was, what kind of water is it that's dead water? Reverse osmosis water. And the second 2 ingredients were sugar. I said, bad for you. I looked at the mother and I said, stop buying that. You're killing your children. Get them to drink water. So, that's really kind of what's happening out there in the world. It's really about marketing that we have. But I'll always start with water, particularly if somebody has chronic things. This is probably one of the important concepts for people who are listening in today, and I'll try to repeat it every week. If you have a chronic disease, you usually have a lot of waste products from the breakdown, the normal metabolism of the body, and you need to flush those out, because when you start to add magnetic products, one of the things magnetics do is they relax smooth muscle, which is what our arteries are. And as they do, we get vasodilatation or more blood flow. And as you get more blood flow, you start to move those toxins, and they get pulled out of their little stagnant areas and spaces. And sometimes people feel like somebody beat them with a 2x4. And so I liken that to, when you and Valerie run, or when you're on your bicycles and you go for a long trip, you may be a little bit sore and a little bit achy. Or if we go out and we're not in good shape, we get that side ache. And that side ache is gone in about 2 or 3 minutes, because it's lactic acid that causes the pain, and the body goes into the bones, pulls the calcium, and alkalinizes that lactic acid to make that pain go away. So if we're drinking alkaline water and we're flushing those toxins, we're not going to have that initial bad reaction by all the toxins being released, and so people will do better. And also sometimes with people with chronic problems, what you have to do is put it on, take it off, put it on, take it off. You can't just put it on and leave it on. And it's very important that the person who's loaning or who's kind of coaching them to try self-care and our magnetic wellness products is checking to see how the person is. Now, the good news is that if they get lots of soreness and discomfort, the good news is that changes are happening, okay? You can certainly point that out. Even though it doesn't feel good, as we've heard in our millions and millions of testimonies, after 2 or 3 or 4 or 5 days or 3 weeks or 3 months, things start to get better. And that's the question. People expect an immediate response. And they'll do that with me with pharmaceuticals. So if I don't want to put somebody on a benzodiazepam, which gives you in 20 minutes this relaxation from an anxiety reaction. And I want to put them on something that's going to be long acting because they have a lot of anxiety. It takes about 3 weeks for it to show up. Well, they'll just want to give it up because they didn't get that response that they had gotten with the benzodiazepam. So the same thing will happen, with these technologies, depending upon your genetics, your diet, your hydration, your sleep, your chronicity of your problem. It takes a while for those new cells to get what they need and to repair themselves and get rid of the waste products, etc. And so it may not be that 2-minute response, although we get that more often than not, which is really wonderful. But it may take days or weeks or months. And many of the stories where we heard, after 5 months of sleeping on the sleep system, I got out of my wheelchair, and my achiness went away, and I got off 12 medications, etc. It's because the body had time to take what it was given and reevaluate and change everything. And certainly the physiologist is going to be better at explaining how that works than I am. But you got to talk in English, Gary. Can't talk in medicine. So let's give it a shot. What I like to say when we start is to introduce yourself and make your question short so we can get as many answers as possible. And then Dave, did you decide you're going to have them put their hand up, or you're going to have them chat the question, or what? How should we try this? We're going to see how it works today. Try a couple different things.
We've got a few people on the line, so we probably have some questions. And let's see, I've got the thing open on the bottom of your thing here. Anybody, if you open that up, you'll see a Q&A. Should we try that first?
Sure. So bear with us, everybody. We're experimenting to see what works the best, because as we get more and more people, this can be kind of crazy as everybody tries to get in first.
Yeah. Also, I have chat opened up so I can see that if you want to just do a chat. Also, while we're going through this, we see the Dr. Gary Linder on, and he's going to be doing a program, let's see, Wednesday night. Also, on this same channel, this link that you have, Rick Murphy, 7 p.m. Pacific time, he'll be on Monday night, and we're just going to have this kind of cycle going around every week. That should be a lot of fun to invite guests to, and just help us remember just how powerful drinking the right kind of water and sleeping on the right sleep system and everything else is. So,
you know what I always say to people is, you don't have to know what I know, you just have to know how to get a hold of me. And so I think that hopefully the beauty of this is that you'll be able to leverage my credibility to help you get people to look at the possibility of self-care and living in a wellness home. And hopefully we can start with some things that will initially make a difference to them. And that's what this is all about. So we expect that you bring new people, bring prospects, bring new potential customers, bring customers that you've had that have questions that really need to expand. You know, sometimes people come in and they have, you know, they get on to our wellness home because of one issue and one problem, but they don't really realize that there's a whole bunch more that they could be doing that will improve the quality of their life. And so that will be one of the things for this. And I'm going to be doing this every Saturday unless I'm out of town, you know, here and there. So Dave will have some, he may have Gary. Why don't you have Gary come in? Or you were talking about Dr. John Jackson. We'll try to see if Dr. John can kind of pace me here. And we'll be every Saturday morning to be able to kind of field these questions and help you out. So either chat into Dave or raise your hand and he'll open you up and you can ask me a question.
Okay, well, David Jones will honor him since he was the first one to raise his hand. And so you're live if you want to unmute yourself, David, and make a comment. David has some pretty interesting health ideas too. He does kind of chiropractic except for the muscles.
Okay.
Are you there, David?
I am. Thanks, Dave. Hi, Dr. Ash.
Hi, David.
And I appreciate you doing this call very much. I just met I met a woman 2 days ago who we met in the afternoon, and by that night she was a new customer already. And she was telling me she has 3 kids, and the middle one is a 12-year-old that has Down syndrome. Have you seen Nikken products provide benefits for anybody with Down syndrome?
Well, I think that a Down syndrome child is certainly just like any of the rest of us, with the exception that they have a little bit deficiency in the mentalness. Sometimes they're a little developmentally delayed. So they may have some bedwetting issues, or they may be a little bit fussy, or they may be a little bit irritable. And as I said before, I would start everybody on the water. Sometimes they're tough children to feed, and they're really picky eaters. So if we can get them hydrated, and then if they're being a picky eater, have them use the KVB as a breakfast or maybe even as a snack to get that foundational nutrition. I think that'll make a difference. And then the next place I would go would be for sleep. So eventually a whole wellness home would be good. Sometimes they'll have respiratory issues a little bit more often than the regular population. So anytime you have somebody with respiratory problems, then our air filters are really, really good. Our immunity is good. So the wellness home in general for Down syndrome, and I think that these technologies help everybody, no matter what their developmental state is, and then we can talk about specific things that, as you get to know them better, if there's something specific they're having an issue with, there may be something specific that we have in our wellness home that they might want to start with or add next. Good
point. Since you were talking about aspirin, let's go here. And I've heard it said that if aspirin were just discovered at this moment in time,
prescription.
It would be a prescription drug, and it would be treated quite respectfully because it is
very much so.
It's very, very powerful. And of course, kind of remind everyone that although you are a doctor, Dr. Ash, you're not seeing them individually, and you'd want to do stuff. And of course, Nikken products don't do anything. It's just all happy coincidence. But it really does make sense that if you give the body what it needs, an optimum environment, the body in its own wisdom will heal itself. But with all that in mind, my friend Ted Baker, he says, my vascular specialist wants me to take aspirin. I am hesitant. The only other prescription I'm on is 100 micrograms of levothyroxine. So, and he's a good guy.
Well, that's not really about wellness technology, so I don't know if my malpractice insurance covers, but I'll kind of give you the general gist of it, Ted. And what it is that as we age, our platelets, which are the little cells in our bloodstream that clot our blood, become less flexible. And so it's kind of like if you take a new car and it has not the Nalgahide seats, doesn't have leather seats, but the plastic seats, and they sit out in the sun. What happens is that covering of the seats becomes more stiff, and it cracks and it breaks, and it doesn't bend and flex like it's supposed to. And the idea behind the aspirin is it helps those platelets to stay flexible and slippery. So as they get down into our small blood vessels, which sometimes start to narrow down because of the cholesterol buildup that happens just as we age, those platelets can move more easily past each other and through that narrowed channel so that we don't clot. And that's the purpose behind that. But your doc probably can tell you more. You just need to tell him you're a little concerned about it and why should you take it. Certainly the other side is that we have to be careful because aspirin can cause bleeding issues. So check that out with your primary care doc.
The omega green or fish oil, things like that might be.
The fish oil, absolutely. The fish oil would make a difference. And water.
Water. Isn't that a fact that more water makes your blood less viscous and less sticky? Exactly.
Absolutely. Absolutely. And, as a matter of fact, when I'm reading blood counts, and I'll have people come in and have them fast because we're going to check cholesterols, etc., I will have a higher hematocrit, which is the concentration of the blood cells, and the higher hematocrit. I just ignore it because I've asked them to not eat or drink anything for 12 hours, and it's because they're dehydrated. And I actually had a specialist send one of my patients back to me because she was very, very concerned about this high hematocrit in this patient. And I said, well, did you fast for that lab? She said, yeah. I said, okay, let's recheck it, not fasting. And sure enough, not fasting, when she'd been drinking water and fluids, she was just fine. So yeah, it happens a lot. So water.
Water is a good thing. Your body's many cries for water, Dr. Batman.
That's a great book. Yeah, great book.
Yeah. Here's another one, since we're talking about doctors. And I'm sure probably this is a very, very unusual question that has hardly ever happened to anyone, but I'll go ahead and read it anyway. What do you say to a customer who says, I've got to ask my doctor first before using this product, like drinking water or sitting down on a seat.
Well, I'd say it's like I love Rick Murphy's response. I used to try to field those questions and give him all this information because I'm very analytical, etc. He says, well, I guess you're not going to be sitting on that seat. I guess you're not going to be drinking that water. No, what I would say is, well, ask your doctor if he thinks that drinking water is important. And I don't have a problem with people wanting to check with their doctor. As a physician myself, I would like to have people tell me about the non-pharmaceuticals they're taking. And as a matter of fact, yesterday I had a lady came in with this many, okay? And they were all what you would think was like A-okay, fine, normal. But what I found was she was taking 66,000% of their RDA of vitamin D, okay? And so if a little is good, a lot is not necessarily better, and actually a lot can be toxic. And I tried to explain to her, I said, your kidneys and liver have to take these out of your system. And so if a little is good, 66,000% of the RDA is not better. It's really bad for you. And those particular vitamins A, D, E, and K store in your fat cells, and so you can get toxic from them. And, you know, she was taking vitamin C because Linus Pauling did the research, and somebody in her family knew the research, et cetera, about vitamin C. And I said, well, actually, what they found out was that it was the zinc that was contaminating the vitamin C that was helping with colds. And so she was taking 8,000 milligrams of vitamin C. Vitamin C is water soluble. It's gonna run through your system, but it has to go through your kidneys, so you're making your kidneys work overtime. So when I got done, bottom line was I didn't mind that she was taking supplements, but I was able to help her put them into you know, a better non-toxic, non-megadose formula that she thought she was helping herself with and not. So if you don't have that kind of open-minded physician, then my suggestion would be get a different doctor. Now, one of the things that unfortunately happens is as Western-trained medical physicians, we, even as an osteopathic physician, we do not get out of the box a lot. We are really trained inside the box of Western medicine, unless on an individual basis we decide to expand and learn about acupuncture and take homeopathic courses, et cetera, or study more of nutrition. I had 5 semesters in nutrition and nursing school. I had 2 weeks of biochemistry that they called nutrition in medical school. And when I taught at the Toro University, what we did was we had the biochemist actually taught a nutrition course that was an elective once a week that students could take. We only had 15 out of 126 students taking it. So your physicians are not well versed, and they're trained about that evidence-based medicine because it's beaten into their head when they're going through their training. So, you know, but you can say, well, ask your doctor what he thinks about breathing air, you know, sleeping 8.5 hours a day, drinking water, and having whole food, organic nutrition. And that should be a no-brainer. And if, like I said, if they want to see medical evidence, time to get a new doctor, because we're not all the same.
Yeah, there's just a thing I'd like to share here, and
yep.
Let's see if
yep, we can see it.
If I got that pointed right. This is. I met a lady, and she said she was on all of these prescriptions and hurt a lot. And when I went over to demonstrate the Nikken, this is her just little thing by her bedroom, the nightstand. And anyway, that's a lot of stuff there. So
a lot, you know, and I think I read something, even in the medical literature, that said when you're on over 7 different medications, you really, really significantly increase the potential for drug-drug interactions and side effects. And unfortunately, sometimes what people do is that they'll see 2 or 3 doctors. One doctor will give them one thing, another doctor will give them something else, and they don't know that each other is doing that. So yeah. I just have people bring their medications in, and it's kind of scary what happens sometimes. Yeah,
a good physician will ask what they're already on, definitely.
Yeah. So my last comment on that one, Dave, is that, you know, for the most part, we haven't done what we're supposed to do to keep our body healthy as far as sleep and eating right and exercise, et cetera. And so we get into these problems and we're living longer, and we actually do need the pharmaceuticals for a while. But as you start to take into your life the wellness home, and you start to be responsible for your own self-care, and you start to include water and to include the good nutrition, organic nutrition, and you start to sleep better, what happens is that you'll find that you don't need to have those pharmaceuticals as much, and we can start to drop them off. Very important that you work with your doctor, that you don't just stop something, you know, cold turkey, because that can get you into all kinds of problems because the body doesn't have a chance to compensate. But that's been my experience, and that's what I say to people, you know, let's get you on the healthy track, and then let's see if we can get you off some of these medications. And I have people who don't want to take anything whatsoever, you know, but they don't want to do anything they're supposed to that's good for them. So kind of in the middle, start to envelop the wellness home into your life, and then work with your doctor on trying to wean back down off medicines and see how you do.
Okay, here's another question. I have a friend who fell and bruised their tailbone. What would you do?
Okay, well, first of all, that's an owie. First of all, I'd want to make sure that they didn't break it, because if they break it, it's going to hurt a lot longer than not. And the little tail comes down kind of like this, and there's a joint right in here that's a ligament. If Nikken would ever get us back our power mag, Dave, that's the perfect answer, because you sit it in your lap and it goes completely through. But the first thing is that you don't sit on it. So you sometimes have to buy one of those little donuts that you can inflate and put on your chair, because as soon as you sit down hard on it, you flare it back up again. It's like having a sprained ankle and not ace wrapping it and going out and spraining it again. It's going to take longer to get better. So you get one of those little donuts you can inflate, sit on that. And then what I would do is put a little chip. And if the chips aren't too big to sit on, then our little tiny ones, maybe just kind of to paste those there. Sitting on the kenko seed would certainly make a difference. Taking the joint would make a difference. And when we talk, and maybe even the CM cream, because it's very close from the skin into the tailbone area. And when we talk about using CM cream versus the joint capsules, this is kind of the theory. When you're talking about the extremities, the areas away from the heart, the joint capsule doesn't get there right away. Okay, so we use the cream for those kind of areas or for the sore spots. And one of the physical therapists that's been in Nikken for a long, long time, Paul Calloway, talks about when he has a problem, he'll have him use a CM cream every 2 hours. And so you can put that on every 2 hours and then start taking the joint. And the initial studies that they did with acetyl myristoyate before it was from the Deal organization was that they tried to overdose people with it, and they found that they couldn't kill the rats. They couldn't stuff any more into their little bodies, and they didn't exceed what we call the MD50, which is that it's the level that kills an animal because of toxicity. And they had no deaths because of acetyl myristoyate. And so it's very safe, and it's also fat stored. So you have to kind of get the level up into the body, and then the body continues to release it as it is needed. So what we used to do was go in and we used to go in and load the dose like 6 to 12 a day for a couple days, and then take it back down to 2 to 6. The other thing that could be used is our wonderful duct tape. Just take a little piece and put that over it. You can put that over the magnetic, since our duct tape doesn't have any magnetic fields in it, that combination. So we'd be hitting it 4 different ways, and don't forget to drink the water.
Sounds good. Let's see. Let me go through here. Let's see. Incontinence. Okay.
Well, you have to find out what the cause of that is. Okay, so there's several different causes that pretty much needs a workup by a urologist specialist. But most of the time, especially if you're female and you've had babies, what it comes from is from weak muscles. And what do you know from strength and balance testing people with magnetics? You know that their muscles get stronger. So, once again, if I had a power mag, I would be having folks use that a couple times a day. Maybe we should just all write in and say, hurry up with that, would you? But otherwise, magnetics. Now, let's talk about how would one get them there? That's a good question. Now, I think we got the Stump the Doc going. It's the muscles that go from the pubic bone back to the sacrum that are the weak muscles. So sitting on a kenko seat would be helpful. You might experiment with maybe using some power chips, and I'm not sure exactly how you could tape them so you could also sit and be able to walk. So you'd probably experiment with them. But one of the things that I would suggest when you're using any kind of magnetics that you're going to tape on would be to use a tape called Microfoam by 3M. 3M is the brand name. It's called sports tape. Like Walmart has it, and Target has it, CVS has it. It's a spongy, waterproof, stretchy tape that you can take off and put on, take off and put on. And so whenever our little power patches, whenever the Band-Aid part doesn't work anymore, you can throw the Band-Aid part away and reuse this sports tape, or this power tape, or this Microfoam sports tape by 3M. So like I said, in Walmart, it's a beige, and it's about a 1/4 inch thick, and it's stretchy, spongy in every which way, and it's called sport tape or Microfoam by 3M. Use that to tape things into different places. And
of course,
you could try the duct tape too. You could try the duct tape.
Yeah, and I think probably muscle tone and exercise and Kegels and
Absolutely.
Yeah. Let's see.
I will say they're working on stem cell injections, because I know a urologist down here is doing a research study on that. And give the body what it needs, its own stem cells, and it heals itself. So you'll see that coming forward. Urology is coming a long way with a lot of new things out there.
Yeah, Gary's got something.
Actually, I had a question that was asked to me that I said, why don't you save this question for Dr. Ash for Stump the Doc? And it was on our self-care series, and it's from Nina Marie Alves. And she says, to please ask Dr. Ash why children can't drink water at birth, and doctors are telling parents babies get enough water through breastfeeding, and it is okay for these babies not to poop for 10 to 12 days because they are breastfed.
Time to get a different doctor.
Well, that's
most babies when they breastfeed, they have 3 to 4 stools a day. So if they're not having stools, there's something that's not quite right going on there. I think that I would definitely be careful about giving tap water, and I probably would be careful about giving bottled water to babies. Okay, if you think about all the toxins, and anytime we're talking about little tiny people, we're talking about the toxic load of anything that we give them is significantly more than when you give it to an adult person who's got a larger body mass. I can tell you one of the reasons they probably say don't drink the water is they don't want to have them fill up. So they want them to have the breast milk or the formula first, so that they get the calories and they get the nutrition, because their little tummies are just teeny tiny. And so that may be part of it. But that'd be a good question to ask the pediatrician or the family physician. A lot of times what I'll do is have them, the other thing is that babies don't usually like how water tastes, and because they're used to the taste of the breast milk and of the formula. And so you try to give them water, and they start, and then they kind of spit. So if I want babies to have water, I'll have the mom give the water first, and then put them on the breast, and then put them on the formula, so that I do get the water down. Particularly important in the summertime when you're in a hot place, and you need to keep those little guys dehydrated, because they get more dehydrated more easily than adults do, or older babies do, older children.
And keep mom hydrated.
Yeah, absolutely.
Oh, we're getting quite a few questions, so we probably better get moving here. Okay, you've been in 15 years. You've probably seen osteoporotic patients. Have you seen anybody improve using the Bone Health Pack?
Oh, absolutely. Amazing. And you probably even have your hands on those, Dave. Amazing studies. There was a video on YouTube that we used to pass around about how she compared her bone density from 1 year to the next, having used the Bone Health. That's significant. And if you just look at the study, it was published in the Journal of Osteoporosis International. They talked about increasing bone density in as quick as 2 weeks. And actually show some graphs in there. So absolutely phenomenal. And when it first came out, we couldn't figure out why. We knew that it was making a difference in bones, but we couldn't figure out why people were saying they didn't hurt anymore, right? It was like, well, what's that about? Well, so then Naidu went in and he did some studies, and he checked the markers for inflammation, and found that 4 of them were affected by the Bone Health Pack. Decreasing the ones that cause inflammation and increasing the ones that decrease inflammation. Try to translate that into English. So absolutely phenomenal product, and I think that the videos that he just did are going to help us significantly.
Oh, yeah, absolutely. Pretty excited about that. Let's see, Ehlers-Danlos Syndrome, connective tissue stretching and loose joints. And
okay, yeah, that's one I'd have to go out and look up. So it's not something I work with right, immediately, but it's basically connective tissue like lupus and some of the arthritises that are out there. So once again, water is very important for these folks, because they don't move their muscles to get fluids moving, the lymphatic system moving, and to get the blood flow moving, etc. So flushing out toxins, having alkaline water is very, very important. And then if you think about doing our flexibility test, if we do the rollout, if we do the mag boys on the back, we improve the flexibility. Anytime you put them in any type of far infrared magnetic field, it's going to help with that. So if they have a joint that's a significant problem that you can put a wrap on, use the wraps, use the bracelets, use the insoles, use the knee wraps, and certainly sleep on the sleep system, wrap in the comforter, far infrared magnetic, and then might even go with the bone health and the joint because of the inflammation and because of that the bone health really doesn't just take care of bones, but it also takes care of the heart and the brain and the eyes, and it helps get us calcium where we need it. So it's really a systemic, a whole body effect.
It seems like so many.
I see a chat come up about scleroderma. Same principle. They're all in the same family. So the water, the far infrared, the magnetics, and everybody should really have a basic foundation nutrition, which is the KVB, the jade green, and the Siaga.
Yeah, it seems like pretty much everything has something to do with the immune system getting confused or
Absolutely.
Whatever.
Yeah.
And, the bone health, osteodance, it just really seems to modulate and get things back on track. So you can't go wrong with that. I even had a lady call me just so happy. Her rheumatologist had actually dismissed her because of her RA and all that kind of stuff. The markers were gone. It wasn't just in remission. It was gone. So what a happy coincidence. Let's see. Got any recommendations for autistic children?
Oh, absolutely. Autistic children do beautifully in the wellness home. One of my main team members had an autistic child, and I worked with her in a clinic, and she came and listened to me talk, and I didn't know she had an autistic child. And she just said, "Do you know that my son was autistic?" And I said, "I didn't." And he was 11 years old at the time. He was in a specialty school. He was afraid of the dark. He didn't want to go to sleep at night. So he would fall asleep and he would be disruptive in the daytime. And so I loaned her a sleep system, and I had her put a pair of insoles in his shoes, and we put a necklace on him. His grades went from D's to A's. And he got a little bit bigger, and she said to him, "Let's get you some new shoes. So take the shoes don't fit anymore. We'll send them to the Goodwill." And so he did with his insoles. Out they went. And then she looked at him. Her older son had a injury and a car accident or a workman's comp case. And so she pulled the mattress away from him and gave it to the older son. And all of a sudden, she was getting phone calls from the teacher again, and his grades were going down, and he was disruptive. And she looked at him and she said, "Alan, where's your necklace?" He said, "Oh, I broke it, Mama. It's in the drawer." And so she realized he didn't have a necklace. He didn't have any insoles. He wasn't sleeping on the sleep system. His grades went back from A down to D again. So she put him back she pulled the mattress back, got a second one for her other son, put him in the necklace, put him in the insoles. He is now handling the family finances. He is going to college. He holds a job at Lowe's part-time. He speaks, and he was always very shy, but we would get him to wellness previews, and he would love to stand up there and tell everybody how much the wellness home helped him. So the wellness home for autistic children is important. It's critical. Sometimes because they're so sensitive, you kind of have to sneak things in on them. So you might find that you put insoles in and they throw their shoes off because they don't like it. So you may have to start with, just the pillow, or just kind of experiment with the different products and slowly introduce them until you can get them into the whole sleep system. The first night we put him on a sleep system, he went right to sleep, which he had never done. And he woke up the next morning and he was dressed, he had his face in his mother's face. He said, "Mama, let's go to school." And she got up and couldn't believe it because she'd always had to drag him out of bed. So you'll hear a million stories about that, about autism. It's really super helpful.
Oh, sounds good. This is one probably want to get checked on. A lady said that she woke up, her right eye was swollen, and then early in the afternoon, the swelling disappeared, but then the next morning, she felt just a glaring white light in my right eye. and then colors seem to fade on the screen, and feeling a little freaked out. What do you think might be happening?
Go directly to the ophthalmologist.
Yeah, that's what I was thinking.
Yeah.
Don't mess around.
Yeah, can't even touch that one with a 10-foot pole without being able to look inside the eye and check it out. Yeah, you shouldn't have vision changes. If it was just a swollen eyelid, like I get that because of allergies, then the sleep mask is really helpful for the puffiness of the eyes, the far infrared and the magnetic and the sleep mask.
Yeah, get yourself to a doctor. Yeah.
Yeah, right away. Yesterday.
Okay.
Yeah, and I might add to that too. If you're seeing bright white lights, that's an indication you need to get to the ophthalmologist right away. So.
Exactly.
Thank you. Okay, Dr. Ash, do you recommend using hand sanitizers and antibacterial lotions or creams?
Well, yes and no. I'm a kind of a soap and water kind of a person. If you think about anything that you put on your skin, it gets absorbed into your body, okay? So when we first got the water, I think those of you who've been around for a while will remember that we used to put OTO in the water, and then we used to swish our fingers in it, and what we would see the yellow disappear and go, and the water would clear up because the body would absorb the chlorine out of the water, and the OTO showed the chlorine. So the body always tries to make equilibrium. So I'm always after my hairdresser to say, you need to be wearing gloves when you're working with chemicals, sprays and dyes and those kind of things. They promote a lot of it in healthcare because it decreases the bacteria count, and we certainly know that we spread disease by bacteria on our hands. But I'm really more of a surface, let's remove bacteria with the surface soap and then be able to wash it off than I am about the hand sanitizer. So you have to think about, am I going to be more concerned about the bacteria that I'm spreading, or am I going to be more concerned about the chemicals that I'm absorbing into my body?
Good point. And I believe some of these new ones are just pretty much alcohol with a thickener rather than carcinogenic chemicals, chlorine compounds and whatnot. So let's see, lupus. Heard of anybody being helped with lupus? What is that?
So lupus is like the Ehlers-Danlos. It's like all the arthritis we talked about. Absolutely. And their biggest problem is toxins, as well as inflammation. So, if we have anti-inflammatory in our bone health product, if we have anti-inflammatory in our joint product, our CM cream, getting the muscles to relax and getting more flexibility by sitting on the seat, sleeping in the sleep system, pretty much the same piece, and then give the foundation nutrition so that this body can make good new cells. But we're really on to this inflammatory process is what's giving us all of our chronic diseases, and that's the thing that we need to get turned off. My personal belief is, and I think there'll be more and more studies, and Gary, you may even know about this, is that this inflammatory process is coming because we're constantly exposing our body to these preservatives and these chemicals that we have in our water, in our food, in the non-organic things that we're having in the air that we breathe. And so the body's inflammatory system says, hey, we're getting attacked. And so it starts to make more soldiers and more soldiers and more soldiers. And because we never get away from that exposure, we never shut those soldiers back down again. I don't think it's because they get turned on and they don't get turned off. I think they get turned on and they stay turned on because we continue to expose ourselves to bad air, bad water, bad food that's not got anything but chemicals in it. That's what I think.
Good point. Kind of along that line, the whole idea of kind of epigenetics, which is kind of the new buzzword, where we're not just kind of pre-programmed and the fate is that we're just locked in and what we are, but we can turn off, keep and suppress the bad ones and express the good ones just by the food we eat, the water we drink. We have a lot to do with that. Along that line, seems to be just an epidemic of IBS. What's that, and can Nikken help with that? Well,
from what I'm learning about the IBS, and I didn't have all that much training on it when I went to school because it wasn't that significant of a problem. And celiac disease was like a board question, but it was very, very rare. But my understanding is once again, because of the preservatives and the chemicals that we have in our food, it starts to make holes in our gut that allow, and I'm not talking about big holes, but I'm talking about the absorption piece, that allows protein that normally would not get into the body without being broken down in the proper way to get absorbed. And that protein is foreign, which then creates that immune response, which then causes us to have a significant problem. And one researcher that I listened to who was really quite interesting said that one of the things we have done is that we've decreased the amount of probiotics, and that we used to have billions and billions of many kinds of these organisms in our gut that kept us healthy and in balance. And now it's like if we do supplementation, it's only 2 or 3 different kinds. So once again, anything that helps with the inflammation, getting yourself to whole foods that and staying away from the chemicals and the preservatives with good water, good nutrition. The lactoferrin gold is like numero uno for what one should be using of our products when they have issues. We have those different kinds of probiotics in our KVB. It's an easily absorbed protein, so that's an excellent nutrition. They do not tend to absorb multi-nutrients and minerals, and so the men's and women's formulas, if they're adult, all those things are important because there's a thing called the Krebs cycle that I hated in biochemistry because it's this big circle and it has all these chemical processes that include the vitamins that come in here and make the process work. Well, if we're not getting the vitamins and minerals that we need, that Krebs cycle of metabolism cannot do its job. We don't metabolize, we don't give the body what it needs. And so that comes from foundational nutrition. So water, the lactoferrin gold, the KVB for a foundation, the men and women's formula, the Siaga, the Jade Green. We're really talking about our nutritionals as a foundation for that one. And then when you get the inflammation and the spasm and the irritation, the Power Mag, here I go again, the Mag Flex on the tummy, the Mag Duo sitting on the chair pad, certainly sleeping in the sleep system, wrapping up in the comforter, anything that you can get the magnetic far infrared, because it relaxes muscle. Remember, that's how it works. It relaxes muscle, and when you get when you get cramping in the gut, it's because of muscle spasm. So.
Oh wow, we got quite a few here. Oh golly, we got some awesome products, and I heard this Dr. Jerry Middleman. He had a newsletter that I used to read, and on the top of it said, "May you never know what you prevent." And I think that's one of the best ways to treat a problem is never get it. And I'm so excited that we got products that can do that. But just a few more. An anonymous viewer says MS. That's a scary thing. We live in the Northwest and we don't get a lot of vitamin D here. That's a possibility. But is MS? Would you want to use Nikken if you had that?
Absolutely. Interesting research that's happening on MS. They're actually working these days now with stem cell, because what happens with MS is the sheath or the covering of the nerve gets damaged and goes away, so that the nerve can't get its nutrition, and then it quits working. So they're trying to create new growth of that by doing stem cell introductions. And I worked in hyperbaric treatment I was a medical director of hyperbarics for 5 years when I was in Northern California. And what they were doing with both cerebral palsy babies and with MS, they were getting stem cell injections and then putting them right in a hyperbaric chamber, because hyperbarics increases stem cell production by about 8-fold. So they were really seeing some significant changes with that. Now, certainly the sooner you do it in the process of MS, the better. I can tell you a story personally that I had. I was working locums up in Oroville, and I had a young man who was 21 or 23 who came in with rapidly progressive MS. There's different types of MS. And he had gone from being able to walk kind of in a limping way to using a cane, to using a walker, and he was about ready to go into a wheelchair. Well, one of the problems that MS people have is they don't have any strength and they don't have any balance. And I put him just in the insoles because that's all he could afford at the time. And we went backwards from the walker. We didn't get to the wheelchair. We went backwards from the walker and to the cane to nothing because it improved his balance so much. So, having having magnetics for balance as far as wrist bracelets and necklace and insoles is super, super important. Sitting on the Kenko seat, sleeping in the sleep system. And then anybody who has any kind of a musculoskeletal problem where those muscles are not moving, working like they're supposed to, builds those toxins up. So once again, I'm going to come back to flush the system with water. Remember that our water is magnetized. I mean, that's probably the first thing that got my attention when I had the demonstration from Herb Rapp was, you know, he had me drink the water and then did a strength test, and my eyes got like this because like, what is that about? So our magnetized water makes a huge difference. And then they use their muscles like 300% more than anybody else does. So they're burning up their nutrition. Same thing for Parkinson's. You'll see Parkinson's people just waste away because they're constantly moving, and that muscle motion is like running a 10K all day long, every day. So they really, really need to support the nutrition more so than just a regular person. They like need to double it up at least and flush it out. So a wellness home is the ultimate answer for an MS person, but start them out by getting them balanced, because the big fear for Parkinson's and MS is that they're going to fall. And if they're older, when they fall, they break. And then when they break their shoulders, they break their upper humerus, they break their hips. And those are tough things to heal when you don't have the youngness and the bone ability anyway. And then they can't get around even more, okay, because they can't use the walker, they can't use the cane. That makes them be wheelchair bound. When you don't gravity weight bear your muscles, they atrophy, they go away. So it just becomes this downhill cascade. So don't let them get to the point where they're off balance and they fall, because then down the hill we go and we end up in, you know, a care home.
Doesn't sound like where I want to go. No,
I take care of those people all the time, and it's like, oh my God, this is like not where we want to be. It's like, this is so much better working here, helping people not ever get to that point. Let me tell you, it's depressing.
Yeah, I just let's there's kind of a.
I got 5 more minutes. I got to make a call at 9 o'clock, Dave.
Okay.
I'm coming back next week and the week after that. Okay, so get to your questions.
Okay, one more, and this is kind of a stream that's kind of going along already. Helping, we're helping each other while we're listening to you too. But it starts out with seizures that started with a 4-year-old, and then someone says get the kid on a pet pad. Lots of neat stories about just kind of nerve stability and magnets, but you go ahead.
Okay, well, I think the other thing I want to mention is that what we're gonna try to set up here is that at the beginning of each one of these calls, I'm gonna try to do a little 3-minute summary of a product that we can maybe cut out and be able to, people can send it. So if you have a question, if I answer a question about such and such and so, and I say use the sleep system, there may be a little mini commercial about the sleep system that you can forward to your customer or to your prospect. So we're going to try to get some more tools as a result of what we're doing here. Seizures is a problem with some type of damage to the conduction system in the head, whether that's because of trauma or toxicity, people who drink too much alcohol, people who use street drugs, people who fall down and hit their head because they have a balance issue, they have a skull fracture, those MS patients we were talking about. That's what tends to cause the seizures. And every time you have a seizure, you damage and kill more brain tissue, okay? So what we want to do is to give the body what it needs, increasing oxygenation and nutrition and blood supply to the head. So to that end, I would certainly, once again, the water, but I would wear one of the necklaces, and I would also sleep on a sleep system, particularly the pillow that has the magnetics in it. And if you're a lady, you could certainly try the earrings and see if that, well, if you're a guy, you can wear the earrings too. They're kind of, you know, gender non-specific, and guys wear earrings. So those are some of the things. We used to use the magnetic headband when we had that for nerve kinds of issues. So you could probably take our headband and put some power chips on it, or even some of the little power minis, and make a headband and see if that would make a difference. So water, go to your nutrition, but mostly think about relaxing muscles and increasing blood supply, which is what using magnetics do.
Okay. Hey, maybe one more question. It's 9 o'clock, 9:01.
Okay.
Okay. Let's see. What's your view on kids taking the supplements, using Vital Balance? I would tend to think if you can eat food, you can eat Nikken, but then
absolutely, that's absolutely the answer. Absolutely the answer. And most of the capsules, you can just open them up and sprinkle them. Yeah, pretty much everything we have, with the exception of the men's and women's vitamin mineral supplementation, can be used by children. That has got the supplements, the men's and women's have got hormone specific for adult men and women, so they don't go to kids. But the immunity, the Vital Balance, it's better food than what you've got them eating when you're feeding them macaroni and cheese and weenies and beans, you know, the kind of things that little guys will like to eat. And certainly the vitamin mineral water and the 10 Pepsis a day.
Well, starting out school with Vital Balance, powering up your brain to awesomeness, or taking your game down with chocolate sugar bombs, where most kids' cereals, the first ingredient is sugar and GMO grains. So yeah.
So what I'll leave you with is my mini nutrition consult for all my patients. I say to them, read the label. If the first 3 ingredients on the label are sugar, don't eat it. And then read the label, and if more than 1/3 of the total calories per serving come from fat, don't eat it. So if you have a half a cup equals 1 serving and equals 100 calories, not more than 33 calories can come from fat. And if they do those 2 things, amazing thing happen to their weight to control, to their energy control. They're not doing the up and down. And we have so many people who are pre-diabetic, particularly our kids. We have kids that are going to have osteoporosis in their 30s and their 40s because of that cola that they're taking in, and because of the marketing that all these companies are doing. And just like that, I started out with that young lady said, well, I'm drinking healthy. And I looked at it and said, no, you're not. I said, reverse osmosis and then sugar. She says, well, they add minerals back. I said, well, that's good because reverse osmosis is dead water. But the next 2 ingredients are sugar. So no corn syrup, no fructose, and no sugar. Those are the 3 things. So if you do those 2 things, that's a really great start.